Hello team, I am going to go over the goals of a full mouth series of x-rays. So the goal of really any x-ray is to diagnose problems or diseases, or to verify that things are normal and healthy. So first I'm going to talk through the bite wing aspect of a full mouth series of x-rays. We'll start on the left side here. We've got the, well, actually let me just back up just one moment. So we want to see specific things in the full mouth series of x-rays. Now ideally certain things like the contacts between the molars should be open. However, if that contact is opened in the bite wing x-ray or the premolar bite wing x-ray, then it's still okay. So we're going to go over starting with the bite wings here, the right bite wings. You can see we want to be able to see the bone here if possible. Here I can't see it on the top, but I am able to see bone here, so that's okay. Ideally, in a perfect world, I would see crestal bone here and here, but part of that, it looks like this patient does have some bone loss. But we want to be able to have open contacts because we want to look right in here and see the enamel. And you've seen where we have decay that's partially through the enamel. A nice open contact will help us to see that. Also, we want to be able to see the calculus that's present, and you can see that this patient does have some calculus present. And then on the premolar bite wing here, again, if we can see the crestal bone, that's great. We want to have nice open contacts. We do minimal overlap like this. It's totally okay. And the goal is to see the distal contact of the canine. So that would be the mesial contact between the mesial of the first premolar with the distal of the lower canine. The reason that we say that is because the maxillary canine is distal to the mandibular canine. So if our goal is to see this contact open with open premolar contacts, we will have achieved all of our goals. So onto the left premolar bite wing. Here you can see we can't see the distal of the canine or the mesial of the premolar. Sometimes with tori or patient's anatomy that can be very difficult or impossible. However, we can see the contact here. It's not perfect, but we can see it's not overlapped to the point where we, oh actually I'm sorry, we jump down here to the lower left premolar PA. We can see that nice ideal contact here. So although it's missing here, we can see it in this x-ray. And then we've got, although we have overlap between 14 and 15, the contact is sufficiently open here. So those would be the goals of our bite wing x-rays. Now in this situation we didn't get that contact. If you could, actually we don't have the maxillary one either here, but let's see, that one, yep, is right here, is good enough. So not ideal here, but good enough. So didn't quite hit the goal on this bite wing. We were saved by the PAs. However, in the situation where we're only taking bite wings, we probably would take an additional bite wing to try to get the mesial of those premolars. So on the upper right PA, what we want to see, PA stands for periapical, or peri just means around, so around the apices. So we want to see 2 millimeters beyond the apex of the teeth of interest. So this would be good. It's a little bit shortened, foreshortened, so we want to have the x-ray source parallel to the sensor. That helps us to not have this shortening effect or foreshortening. Moving on to the upper right premolar bite or PA, we can see the apex of both of these with some bone around them, and then the canine, upper right canine PA, Looks like the apex is right here, so we've got a good view there. We also have the lateral in this one and another view of the apex of number 5. Moving on to this X-ray, this is a ideal central, maxillary central PA. You can see plenty of bone above the apex. You can see the apex of both laterals, and then again, number 10, you can see here the canine. I can't quite tell here. I believe the apex is right here. So I think, yeah, it is. So we're all in good shape there. You can also see the apex of 12 and 13, which is good because the apex of 12 is not in this one. So if you were just taking a PA of number 12 for like a pre-X-ray for a crown, this would not be acceptable. We would need another angle to try and get that apex. The upper left molar PA, I would say this is good, or certainly acceptable. Let's see, on the lower right molar PA, I'd say this is good, just good enough. Right here we want to have the 2 millimeters. I think they're good examples. The premolar, we've got enough here. It'd be nice if this were a little lower, but sometimes if you have a very long root, that can be challenging. Also, we do have the option of the 3D X-ray to verify the apex, typically in our office, but just in general, we want to make sure we have 2 millimeters of bone beyond the apex. The lower right canine X-ray, this one actually isn't completely ideal. This patient does have some very long roots. We would want to have a little bit more beyond the apex of this canine. So I can see there's some space up here. Of course, that's where the sensor holder is. So with this one, you may want to have this view, and this gives you a little bit better view of the bone height, but then maybe come in with a little bit steeper angle. So angling the sensor in a way and lowering the source or the X-ray source a little bit lower and aiming up to try to capture the apex. You really want to think of what you're doing is casting a shadow of the root on the sensor. That's how I like to think about it when I'm working on my angles. Now, that being said, when we take the central X-ray here, we have the central and laterals very nicely, and it looks like we have the apex of the canine right here. So in this situation, it's not here, but we do have it in this X-ray. The X-ray here looks like also, man, that is such a long canine. I can see apex here. So not completely ideal on this canine. We want to make sure that we've got 2 millimeters ideally, but at least 1 millimeter beyond the apex of the root. So didn't quite hit the target here. You want to make sure you have this. And premolars, we have this here. Also, right, we cut off a little bit of the root. Can just about see the apex. So I would say this one is less than ideal. And then the molar PA, I would say, is good. So in general, this is a good example of an FMX. I did point out some areas of shortcoming from what we can see, but we want to keep in mind what are the goals of each X-ray that we take. Many times we're taking a full mouth series of X-rays like this. Sometimes we take a single bite wing or a single PA, and you just want to understand what are the goals. So with your bite wing, you want to have nice open contacts. You want to have the patient biting down so you can see as much of the teeth as possible with your sensor centered in the occlusal plane. You know, in the periapical radiographs, I mean, it's in the name of the X-ray. So we want to be able to see around the apex. We don't want to foreshorten or elongate the teeth, so we want to have the source of our sensor, or our source, parallel to our sensor. And if you need any help with positioning or any other input to help you make your X-rays better, please speak with a teammate who's more familiar, has more experience, or one of the doctors. So thank you all for all the effort that you put in. I wanted to offer this as an explanation of the goals of a full mouth series and of the individual x-rays, and just keep up all the good work, and I hope you all have a great day.